everyone. It's good to see you guys. As always, we don't let our doctors come out here without a little introduction. So I'm sure you guys all have met Dr. Justin Mariano, and it's been a good 6 months now since I've been in his presence. He really, you know, I said it before and I'll say it again, he's really like a big brother. He's taken Dr. Tyler and I under his wing and really become a mentor in a lot of things that we do here. And I'll tell you, getting to know him, he's just got such a heart of compassion, you know, for the message of chiropractic, but really for you guys. You know, it's really the joy and the stories that he gets to share, the time he gets to spend with you guys. The reason, you know, that's really the reason why he comes here, and that's why the chiropractic message is so important. He has such a big heart. I'm so excited about tonight's message because it's really relevant for our lives. It's really relevant for most of us, even starting at a young age. And he's going to bring some great truth tonight, some great science, some practical wisdom for you guys to take home and begin to implement. So let me welcome Dr. Justin Mariano.
Awesome. Thank you, brother. Appreciate it. That was awesome. Thank you very much. It's good to see everybody tonight. This is an awesome crowd. I'm really excited because I love these workshops. It gets us a chance to really sit down, kind of get intimate here in a nice small group, and really talk about some of the health issues that I know you guys have questions about. So tonight what I want to do is dispel a few myths, okay, and answer a lot of those questions that I know that you have. I have about 30 minutes to get through a lot of information, and I'm going to do that the best that I can. So I'm going to talk fast, and at the end of that time, if you have any questions, we can answer those then, okay? First of all, what I want to start off with is basic principle that I'm sure we're all familiar with here, and that is our decisions, our choices, dictate our outcomes. Really in any area of our life, but especially when it comes to our health, right? I think by now, for those of you who have been around this practice long enough, you've seen and understand how that works. And for those of you who haven't, I'll be explaining that tonight quite a bit. But our decisions, the choices that we make every day, dictate our health outcomes, okay? This is what I often see though. When people are not, when they're not happy with their outcomes, okay? When they don't like the outcome that they've had, they go back and they make a different decision or a different choice, expecting a different outcome. And when that doesn't work, they go back and they make another decision and a different choice. And they get caught up in this loop sometimes of wondering like, why is this not working? Why my outcomes, why are they not what I expected? And really what we have to do is go back and look at what drives our decisions and our choices. And I think if we look deep enough, we'll understand, come to the conclusion that it is our core beliefs, okay, our paradigm. Our core belief in terms of what we think and what we believe about health ultimately drives our decisions and choices, which dictate our outcomes, okay? So when we're not happy with the outcomes that we're getting, and we've gone through that loop a few times, what we have to do is stop for a second and really identify what do we believe in regards to our own health, or health in general, okay? So what is your paradigm? That's a question I have for each and every one of you. What is your belief regarding your health? Through what lens do you view health? Your own health, your family's health, health in general, okay? There's a couple different models out there. One is the allopathic model. And this model is one of the more common ones, unfortunately. And basically, many people believe that the body is not intelligent, that the body is dumb, and that the body is prone to break down, okay? And that sickness is due to bad genes, bad germs, or bad luck, all right? And I think that we know by now that this is a failed model. Just look at the health crisis that we're in today in this country, right? This model is not working for us, right? And we know that that's a failed model. And what it's done is it's created this approach to health, this outside-in approach to health that has really led us astray, okay? So there's a different way, there's a different model, and that's the wellness model. And this model is the model that I've seen to be very true through my experiences, and I want to share this with you. The body is smart, folks. Your body is intelligent. Amazing, amazing power, healing power within your body, okay? The body is designed to be healthy, okay? We were created to be healthy, and we express health. That's our natural default, is to express health, okay? Sickness is either due to toxicity or deficiency. We're either putting the wrong stuff in or not putting enough of the good stuff. Make sense? Okay. So that outside-in approach to health has led us to this, I guess, where we sort of chase symptoms and really focus on our symptoms. And a dangerous belief is that if I don't have any symptoms, I must be healthy. And what we're finding is that is a very dangerous approach to your health. Okay, and here I'm going to explain why. I love this graphic because, as you know, we're in the body signals series here in this workshop, and symptoms are essentially body signals. Okay, it's your body telling you that there's a deeper problem. And we're all familiar with that graphic, right? It totally makes sense. It's a great illustration. When you look at an iceberg, what you see on the surface is only 10% of the true mass of that structure. 90% of it is lurking below the surface where you can't see it, right? Same thing happens in our body with our symptoms. When you realize that you have a symptom, that's your body telling you that there's something deeper and probably much more serious below the surface that you need to take a look at. It's kind of like our body's natural alarm system. Now, if you're laying in your bed at night and you hear your smoke detector go off, and you go out into your kitchen and you see, oh, I left that pan on the burner, and there's smoke everywhere, right? And flames are billowing. Do you turn off this detector and go back to bed? No, right? You wouldn't have a house left. No, clearly not. You grab a bucket, you put out the fire, you take care of the cause of what's making that noise, right? So if that seems like such a silly question, then why do we do it so often with our bodies? Think about that. We have symptoms in our body. Our body's telling us there's something wrong, and what do? We turn off that alarm system and keep on going. Go right back to sleep. And then we wonder why we're in a health crisis, okay? So tonight what I want to talk about is one particular symptom called osteoarthritis, okay? And I'm going to be focusing on the spine tonight because that's the most important area of the spine. But really, the concepts that I'm talking about, you can use that and basically apply it to any joint in the body. There will be times when I'll be speaking about specific joints, and at the end, if you have any specific questions about anything, please let me know. I'll be happy to address that, all right? When we look at the word arthritis, what does that mean? Well, if we break it down, arthro means joint, and itis means inflammation. It literally means inflammation of a joint, all right? So what I want you to think about when you hear that word is joint degeneration, okay? And it has many different names. Degenerative joint disease, degenerative disc disease, DJD, arthritis, disc degeneration. It's called many different things, but what we're talking about is osteoarthritis, okay? Some of the common known risk factors, and again, this is part of that myth that I'm going to debunk tonight. Age, I think we're told that's part of the natural aging process. Yeah, we're going to talk about that for sure, because that's definitely not the case. Trauma, obesity, misalignment, gene defects, diseases, and of course, females it's most prevalent, right? So we're going to talk about this tonight. Now, when it comes to arthritis, over 20 million Americans suffer from arthritis, okay? 50% of Americans over 75 years of age struggle with this. And some of the signs and symptoms of that, some of the signals that you may be experiencing are joint changes. So changes in the way that the joint moves and the way your joint feels, okay? Stiffness or loss of motion, okay? So that's changes in the range of motion. If you lose range of motion of a joint, that's what we're talking about here, as well as swelling. Then we have crepitus, creaking and cracking, that grinding, popping noise. I'm sure everybody has experienced that once or twice. I know I have. That's the presence or absence of pain is another one. So think about that for a second. The presence or absence of pain. What do you think we're trying to tell you there? That pain, you don't necessarily have to have pain to have degeneration in your body. In fact, so many times we'll see someone who will come in seeking help for a problem, say, in their low back. When we look at their x-rays, we find advanced degeneration somewhere else in their body where they had no symptoms at all. Okay? So you don't have to have pain to have degeneration in your body. I want to make that very clear. So what is the outside-in approach? What is the common approach today when we go to seek help? Well, typically the first thing that will happen is they want to throw medication at it, right? They'll want to issue medication. And when you're prescribed medication, what are they trying to do? Think of that alarm system. go ahead and yell it out. They're trying to mask the symptom, right? That's essentially what they're doing. When you're taking an anti-inflammatory drug, what they're doing is just turning off your body's alarm system. The problem is that it never gets to the cause of that symptom, right? When we look at non-steroidal anti-inflammatory drugs, most of these are over the counter. The American Journal of Medicine says that 107,000 people are hospitalized every year from severe GI distress. And most of the time that's GI bleeds, okay? 16,500 people die every year. And that's just among arthritis patients, all right? That's for one symptom, folks, just arthritis alone. So this is what we're up against, all right? It's not working. The system's not working, and it's killing us. Vioxx, who's ever heard of this one? Anybody? So Vioxx was a popular drug that was created by Merck. They designed that drug, okay? One of the biggest pharmaceutical companies in the country. It was approved by the FDA in 1998 and was released on the market in 2000. By 2004, it was taken off the market. And at that point, there were 140,000 people who had serious side effects. And there were over 60,000 people dead. That's one drug, okay? That's a major pharmaceutical company. And the FDA approved that. So let me ask you a question. Do you think that they have your best interest in mind? Do you think when they're designing those drugs, do you think they have your health in mind? Obviously not, right? So if I had a product, doesn't matter what the product was, let's say it's widgets, whatever, and that product caused one death, I would pull that off the market immediately, okay? So why did it take 4 years and 60,000 deaths before they were forced to take it off the market? Okay, we can't rely on the pharmaceutical companies to keep us healthy, folks. Okay, it's a failed system and it's killing us, literally, all right? So what's next? If drugs don't work, if medication doesn't work, what's the next step when it comes to arthritis? Usually it's a cocktail of cortisone and painkillers, injections, okay? And they'll inject that either right into the soft tissue, sometimes right even into the spinal canal. And when that doesn't work, we move right on to surgery, okay, fusion surgery. What they'll do is they'll go in there and they'll fuse the joint. Now, what I typically see when somebody comes in and we take x-rays, somebody will have a fused joint, and guess what? All the joints around it are now beginning to break down. Because guess what? They never addressed the cause of the problem. Do you see this vicious cycle that we're in terms of our health? It's literally killing us. This doesn't work. So we need to reassess and take a better look at what we're doing. So what do joints need in order to be healthy? 4 things are absolutely necessary in order for a joint to function properly and heal, okay? That's proper motion, proper alignment, a nerve supply, and an oxygen and nutrient-rich blood supply. You have to have all 4 of those things. If you take away any one of those things, that joint will break down and degenerate over time, okay? There is one thing that I know of that interferes with all 4 of those. Can anybody guess what that might be? I'll give you a hint. It starts with an S and it ends in subluxation. Anybody? Exactly right. Subluxation. Okay, that interferes with all 4 of those things. And we're going to talk about how that happens, all right? Before we talk about subluxation, I have to talk about my most favorite thing in the world, and that is the spine, okay? So for some of you who have been in the practice a while, this is going to be a bit of a refresher. For those of you who haven't, this will be a great opportunity for you to find out about the spine here. Spine is awesome. We have 24 movable segments stacked on top of one another, and those are called vertebrae. And a vertebrae is essentially a ring of bone. And when you stack those rings of bone on top of one another, they form one big tube of bone. So if I were to look through this spine, through a bird's eye view, it would be one hollow tunnel of bone. And the way this works is at the top, the brain sits up here in the skull and sends the brainstem down through that big hole. And the spinal cord, which is an extension of the brain, continues all the way down through that hollow tube of bone. Okay? Now, when we look at the spine front to back, we should see it nice and straight. We say straight is strong, right? If you put a kink in that spine, or there's any type of listing or leaning away, that spine will fail under load. So when we look at a spine front to back, this is what we want to see, nice and straight, okay? When you look at a spine from the side, you see this nice set of curves in here, okay? And these curves is the natural shock absorber of the spine. You see the discs right in here, these are not shock absorbers. I know we've been told that, but they're actually spacers. And what they do is they provide enough space so that these nerves can exit the spine freely without any interference, okay? It's the curves of the spine that act as a shock absorber. They help absorb all that stress and force that we place on our body throughout the day and protect those vital discs to keep them healthy so that those nerves can be free of interference in there. Now, how cool is that? All right. So when we have a subluxation, I'm really going to break this down deeply tonight because it's really important that you understand exactly what's going on in your body and why we take this so seriously. All right? I know we're weirdos. I get that. Okay, now you're going to understand why. All right? So when you have a subluxation, there's a joint misalignment. All right? That joint is either jarred or shifted out of its proper position. Now, when it comes to motion and alignment, again, what 4 things are necessary for a joint to be healthy and function properly? Proper alignment, proper motion, nerve supply, and a proper blood supply. So we're missing out here on the motion and alignment. If your tires on your car are out of alignment, are they going to wear better or worse? Way worse, right? Same thing in our body. If that joint isn't moving properly, and we continue to walk around and do the things that we do, that's going to wear out over time, essentially. It's going to degenerate, okay? Normal motion is critical. 8 weeks of lack of motion is enough to have a degenerative decay in your body. Only 8 weeks, all right? So think about how long people are walking around subluxated with those joints misaligned, and think of the degeneration that takes place. It's easy to see how, you know, within a few years, you could have a spine that is in bad shape. Then we have the effects on the kinetic chain. So I'm going to explain this briefly to you here. The kinetic chain, that's the concept that if you have multiple joints together, that each one of those joints will have an effect on the other. Meaning that if I have, say, a low back issue and I don't take care of that, over time, that's going to affect my hip joint, which eventually will affect my knee joint, ankle, and so on. Okay? So we can't just ignore a problem and not expect it to affect other joints in its vicinity. Okay? We have problems with the kinetic chain there. So motion and alignment are crucial. One thing that we see happening is that when there's a subluxation, that joint is misaligned, and now what happens is it displaces its weight backward, and now it starts to affect all the smaller joints around it. These facet joints begin to break down over time. Facet joints are in the back here. These are these tiny little joints. Those are the ones that make those little noises that I know you guys love to hear when you get your adjustment. Okay, those are these joints in here. Those joints were not meant to hold our weight. They're meant to guide and limit motion. But when you have a subluxation, what it does is it throws all that weight back on those facets. And over time, you see degenerative changes occurring in those joints as well. Okay? So what's next? After joint misalignment, there's soft tissue damage. Okay? It damages the disc. The disc is not this hockey puck of just thick material that sits in there. It's actually a very complex, organ system. And what it is a bunch of concentric rings of material that are wrapped around a nucleus, okay, this gel-like material in the middle. Well, when you have a subluxation, what it does is it deranges those fibers. Anybody ever twisted their ankle? Right? You roll your ankle and it gets swollen and inflamed. That same thing is happening on a smaller level in your spine. So once you have soft tissue damage, now we have inflammation and nerve irritation. So that tissue swells up in there and starts pressing against the nerve, interfering with that nerve. It irritates it. And what happens is it interferes with the brain's ability to communicate with whatever that nerve is going to. So if that nerve goes to your stomach, okay, it's interfering with the brain's ability to communicate with the stomach and vice versa. Okay? Whatever that nerve is going to, it's going to affect that organ system, tissue, or cell. Okay? After that, your body senses that there is an injury there. Okay, is your body smart or stupid? Very smart, right? So your body now takes your muscles and it says, hey guys, we have an injury here. We have to lock that joint down. So a muscle that at one point was moving the joint, it's telling it to change roles. And now it straps that joint down and locks it into place, okay, to protect it. It's a defense mechanism and it's phenomenal. But it creates joint fixation, all right? And over time, what happens is we lose imbibition. So I'm going to explain imbibition because this is really important in terms of what we're talking about tonight, folks. I brought props. All right. Sponges is right. Imbibition simply means it's the pumping action of a disc. So a disc, like any joint or any ligament, doesn't have a very good blood supply. So it relies on movement to get nutrients in and waste out. And it works very similar to the way a sponge works. Okay, when you're moving, what it's doing is it's squeezing fluid in and out. Okay, it's sucking fluid in, nutrients in, and it's squeezing out waste. Okay, every time you move, this is what the disc is doing, right? Bringing nutrients in and waste out. Even as you're sitting there, your body's making tiny little micro corrections to keep you upright. And even that little bit of movement is enough to bring in nutrients and pump out wastes. Okay, if you lose that ability, what do you think happens to that disc over time? It begins to degenerate, right? So we have this beautiful disc right here. Over time, what happens is it begins to break down. So I'm going to pass this around and let you have a look at that. A disc that looks like that over time will degenerate. And that's essentially what we're talking about tonight is arthritis, okay? So you can pass that around. So let me ask you a question. Which one of these do you think is going to be able to bring in nutrients and pump out waste better? You got it, right. Over time, what happens through degeneration is that a nice healthy disc starts to wither away and essentially die, okay? So I wanted to show you that comparison there so you can see what's going on. So this happens not just in the disc though, it happens in all your joints. Whenever you're moving a joint, you're pumping fluid around. You're getting those lubricating fluids moving in the joint. Okay, you're pumping blood to the joints. Movement is essential because over time what happens is that degeneration, that arthritis, all right? So a common question that I hear, is degeneration part of the natural aging process? What do you think, guys? Yes or no? Absolutely not, right? So spinal and nerve system deterioration has nothing to do with age. If it did, guess what? By the time everybody hit 70, 75 years old, all their joints in their body would degenerate all at the same time, right? With everybody. And it's not the case, all right? While all the bones and nerves are the same chronological age, they age separately depending on their alignment and ability to function normally. And what that means is subluxated joints will break down quicker. They'll age quicker, okay? So what are the four things we need? Proper motion, proper alignment, a nerve supply, and the last one, blood supply. So we've talked about the first three. I want to discuss blood supply with you because this is important for you to understand. Joints have a very limited blood supply, as I said, but bones are very vascular tissue, okay? We think of bones as being very hard and very solid, but they are very vascular, okay? Meaning they have a great blood supply. So it's essential that we keep the blood supply to those bones that make up that joint healthy if we want a healthy joint. So a lot of you have talked about extremity issues, right? Arthritis in your hands, ankles, feet, knees, right? If the blood supply to the bones in those joints is not healthy, you're going to have problems with the joint, okay? The joint's going to degenerate and break down. So exercise increases not only blood flow, but again, that imbibition that I'm talking about. Sedentary lifestyle decreases that flow. So what else affects blood flow? Anybody? Again, I'll give you a hint. Starts with an S. Exactly right. Perfect. Perfect. Subluxation, right? So your blood vessels have a nerve supply, just like any other cell, tissue, or organ. And I love this graphic here. This is a great picture. You see the blood vessel in red, and that bright green color, that's the nerve fibers there innervating that vessel, okay? So if the nerve feeding the blood vessels is impinged or subluxated, do you think you're going to have a healthy blood flow? Absolutely not, right? And the spinal bones protect those nerves. So many times somebody will come in and say, hey, I have an elbow issue or a knee issue, and I start taking care of their spine. I don't get it. Why are you taking care of my spine if the problem is in my elbow? This is a prime example, one of the many reasons, okay? We know that if we don't clear out your spine first, that extremity, that ankle, those hands, hip, whatever it may be, is never going to heal properly. We have to restore proper nerve supply to those extremities, okay? So what do we do about it? We created a problem here tonight, right? We've identified a problem, so let's talk about the solution. First and foremost, you have to have your spine checked. Plain and simple, all right? You got to get your spine checked. And how do we do that? How do we identify subluxations? Well, in our office, we have 5 objective criteria. Instrumentation, okay, instruments that help us identify areas of inflammation. Motion palpation, that means we get in there and we check those joints to find out if they're moving properly. Static palpation, we find out where the inflammation is, if there's any tenderness, okay? Visualization, so this is a very powerful tool that helps us assess any asymmetries in your posture. Your body's really smart. If there's any nerve irritation, you're going to bend and twist and lean away from those nerves to kind of open up space and give them room to breathe. So we can see that when we're assessing your posture. It's a very powerful tool, and we'll talk more about that in a second. X-rays. Those also help us identify not only if there is degeneration present in your body, but how long it's been there. Okay, very important tool. So for anybody here tonight who has not had their spine checked, okay, I want to make sure you have an opportunity to do that tonight. So before you leave, see myself or one of the other doctors, and we'll do a very quick test looking at your posture to see if there's any nerve irritation in your body. So please don't leave before you have your spine checked. It takes a couple minutes, and we'll talk to you more about that before you leave. What are some other things we can do? Well, what about movement? All right? What about movement? Folks, we're not doing it right, okay? I can tell you that right off the bat. Look at this. In an effort to make things quicker, faster, and easier, we have engineered movement out of our lifestyle. And because of that, our joints are literally degenerating, okay? I love this one. All right, doesn't that just epitomize our culture today? Unbelievable. So your joints need movement. Now, I personally love CrossFit. That's the way I like to work out and the way I like to get my joints moving. But I understand that that's not for everybody, okay? So there are other ways to keep your joints moving and make sure that your joints aren't breaking down. Yoga is phenomenal, okay? I like yoga myself. It's amazing. Tai Chi is another great one. Now, I've never done Tai Chi, but I can tell you that it uses a lot of fluid movement while also working on your breathing. Okay, it's another way just to keep your joints moving. It could be something as simple as walking, going for a walk 30 minutes a day, okay, every day. For those of you who are having issues with your hands, clay work has been known to really help keep those joints mobilized and increase blood flow to the hands, all right? Knitting, my favorite, thumb wrestling. If you don't have a thumb wrestling buddy, give me a call, okay? Saturdays is thumb wrestling day in my house. So the point is, folks, we have these joints that were meant to move, and if you don't use them, you're going to lose them, okay? So find something that you identify with. If you're really curious about any specific activities such as Tai Chi, yoga, or any of the other ones, please come and talk to us. We can hook you up with somebody who can give you a demonstration, okay? What else? What else can we do to reduce the inflammation in our body? What about the way that we eat? Okay? So where have we gone wrong? We have turned this into this, folks. So many people walking around eating a pro-inflammatory diet. Again, in an effort to make things quicker, easier, we've turned healthy, live food into processed, prepackaged garbage. Okay? It's not working. So what do we eat? Well, organic, grass-fed, grass-finished meat. Okay? Wild-caught cold water fish, organic free-range eggs. You want to have plenty of fruits and veggies. Now that doesn't mean to eat your weight in strawberries and bananas, okay? It's the vegetables that I really want to focus on, especially the green leafy vegetables, all right? Healthy fats, so that's going to be your coconut oil, olive oil, avocado, seeds, nuts. And everybody should be taking a good fish oil supplement, all right? And with fish oil, what you want to do is you want to take a triglyceride. So there are some that are what they call ethyl esters, and those basically you don't want to take those. You want to take a more natural form of fish oil. So if you squeeze a fish, triglycerides come out, and that's what you want, okay? Triglycerides. So if you have any questions about fish oil in terms of how much you should be taking or what's a good source of that, a good brand, please come talk to us. We'd love to help you with that as well, all right? What people are doing is not working, okay? If we keep doing what we're doing, we're going to keep getting what we're getting, all right? We can't continue to put our heads in the sand. The problem's not going to go away. It's just not, all right? Folks, you have an amazing body that was meant to self-regulate and self-heal. We've done a great job of getting in the way of that. So don't forget the fact that the outside-in model is just not serving us, okay? And there is a better way, and we can help you with that. So I'd love to answer any questions that you have tonight. Before I do, I just want to mention that, we talk about symptoms in here a lot because we can't ignore them. But understand that chiropractic was not meant to just serve that, okay? It wasn't meant to treat or cure symptoms, okay? There's much more than that. And the time to start taking care of a lot of these issues that we talk about is before you have a symptom. So don't wait until your body's talking to you, all right? Have your spine checked. Ask questions. Be proactive with your health. Because by the time those symptoms really start coming on strong, the problem's been there for way too long, okay? So I appreciate each and every one of you for being here tonight. Thank you for your time and your attention.